You are listening to Little River Radio, the official podcast for Little River Physical Therapy. On this podcast, we'll explore topics related to health, wellness, and injury prevention. I'm your host, Roxanne Darby. Keep in mind that every body is unique, and therefore the best approach to health for you needs to be individualized to you. Work at your own pace and mind your own body. The advice shared in this podcast is general wellness information and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you are seeking medical treatment or advice, please talk to your health provider and be sure to consult with your doctor before implementing any lifestyle changes. Today, we will talk about stress and depression. You'll hear about the links between physical health and mental health, the role of the hormone cortisol in your body, and get some tips from your local physical therapist, Dr. Fisher, on stress relief and how physical therapy can help your mental health. Let's get started. Physical therapy and mental health. Brendan Stubbs, who has worked as an in-house physical therapist in multiple mental health wards, stresses the importance physical health experts hold in mental health settings. Stubbs noticed how sedentary the life of mental health patients is, and that they are often forced to sit within eyesight of their doctors all day long without even an opportunity to go outside. Stubbs found that when he began taking daily walks with patients and taking them to the gym, they seemed more emotionally comfortable with him than with their doctors and shared more about their daily lives. The exercise itself also made them happier. In one mental health facility for older patients, Stubbs introduced outdoor group activities, and he described seeing their faces light up. When he saw how much excitement the group activity sessions created, he hosted an info session about the importance of physical exercise for mental health, handed out pedometers, and put a big chart on the wall for people to write their weekly step count on the wall. The patients became very competitive about the step chart, and the hospital saw an increase in their cognition, mood, and energy levels. Ask your PT. What advice do you have for someone with depression? The latest medical advice is that you need at least 15 minutes in the sunshine every day to get sufficient vitamin D for your general health. A recent study conducted by JAMA Psychiatry found that if adults are physically active, they can substantially reduce their risk of depression. My advice when you're feeling blue and finding it difficult to exercise is to commit to getting outside for 15 minutes a day for 2 weeks and see what difference that makes in your life. Try walking during this time. Your goal should be to walk for the whole 15 minutes. It's perfectly normal to feel depressed when you feel bad physically, so it makes sense when your body feels better, your mood lifts. Of course, exercise can't solve all mental health problems, but it certainly will help your body and is definitely worth a try. Once you are comfortable with the 15-minute outdoor walk, increase to walking for 30 minutes a day. Cortisol, your body's stress regulation hormone. Did you know that your sleeping cycle, stress levels, and metabolism are all controlled by the same hormone? They are all controlled by cortisol, a steroid hormone released from the brain into the body in response to stress. When you experience stress, cortisol is released from the pituitary gland in your brain. But the release of cortisol isn't a bad thing. It is one of the body's most essential regulation mechanisms. Cortisol is released to wake you up in the morning, setting your diurnal rhythm, the daily cycle of when you are asleep and awake. Your cortisol levels should be highest in the morning and drop gradually throughout the day. But the timing of cortisol releases relates to your daily patterns. So, people who work at night often have conditioned themselves to be nocturnal with their cortisol releasing at night. Almost every cell in the body has receptors for cortisol, and so it does many different things. Cortisol is the hormone responsible for regulating your body's stress responses, blood pressure and blood sugar, metabolism, and salt and water balance. The regulation of all these things determines your sleep-wake cycle and affects your emotional regulation and stability, as well as your cognitive function and ability to process memories. Healthy or unhealthy sleep, stress, and metabolism all either positively or negatively reinforce each other depending on your lifestyle. In addition to daily regulation of the body, cortisol is also released in larger quantities during a stressful situation, such as triggering the birthing process. Abnormally high levels of cortisol will cause problems with stress, sleep, metabolism, memory, and emotional regulation. They can be caused by abnormal sleep patterns or chronic stress levels. Endocrine disruptors can also cause an unhealthy overrelease of cortisol. Endocrine disruptors are natural or man-made chemicals which mimic the body's hormones, interfering with the body's normal hormonal patterns. They can be found in everyday products such as cosmetics, food and drink packages, toys, and especially pesticides. Abnormally elevated cortisol levels can cause Cushing's syndrome, which is characterized by increased fat on the tummy but very skinny arms and legs. A 2013 study on the effects of stress on postmenopausal women found that chronic stress caused long-term oxidative damage. Postmenopausal women with oxidative damage experienced anticipatory stress. Anticipatory stress is the release of cortisol too early in anticipation of the stressful event instead of at the correct time, manifesting in anxiety. The women with moderate to high levels of stress had the most effective cortisol release, much better than both the women with chronic stress and the women with low levels of stress. A 2021 study found that exercise can be a good way to improve the effectiveness and timing of the release of cortisol within your body. The release of cortisol during exercise is a healthy way to release cortisol that can prevent the over-release of cortisol in response to psychological stressors. Ask your PT. Stress relief. As humans, we have to suppress our stress, which is not a bad thing, as we don't want to go around punching people who annoy us. But this stress has to be stored somewhere. Most people hold stress in their necks, but others hold it in their lower back or even in their pelvis. It's important to get in touch with your own body and to learn where you hold your stress. You can't hold on to it forever. I find many of my patients are so focused on tensing one muscle where they store all their stress that they limit the ability of their other muscles to act. Much of my work as a PT involves helping patients release tension from the tight muscles and strengthen the other muscles that have become weakened from being underutilized. It is very important to become aware of stress and your body's response to stress so that you can find ways of releasing it. One quick hack involves laying down with either your legs straight or knees bent and doing a muscle relaxation exercise to help you relax. Please visit our YouTube channel to follow along with a muscle relaxation exercise. You can find us at Little River Physical Therapy on YouTube. Thank you for listening to Little River Radio. If you have questions, comments, or suggestions about this podcast, you can email us at thelittleriverpost@gmail.com. Otherwise, I'll see you next time.